Hello, and welcome to Meeting the Challenges of Home Care Through Alternative Means. My name is Jamie Collins. You can see on the screen my email address as well as my website. If you ever would like to reach out, I would love to hear from you. And let's get started. I am a hygienist. I've spent about 22 years in the dental field. Work clinically. I work as a key opinion leader and subject matter expert for various companies. I have been fortunate enough to speak at events from coast to coast and present webinars. I worked in education and course development through big multi-state school systems throughout the country. And I am a recurrent author in multiple publications. I've had about 70 articles published to date. And then I've worked as a contributing author to multiple textbooks. Some of those you see at the bottom there. If you've been tortured by the case review studies, please don't judge me by those. And let's get started. I do want to thank Sunstar for sponsoring the webinar today. You'll see products throughout, including Sunstar, as well as others throughout the presentation that are always some of my favorites when I treat patients. Our learning objectives. We're going to talk about how to implement a customized home care plan for patients, how to become familiar with alternative products or methods for home care. As you all know, one size does not always fit all. And then we're going to discover patient motivation avenues, even when they're not directly in the dental office with us. When we look at statistics, 47% of adults over the age of 30 have periodontal disease. 70% over the age of 65 have periodontal disease. 52% of the children under 8 have experienced at least one cavity in their life up to that point. And 25%, 1 in 4 adults aged 20 to 64 currently have active decay. That's a big number. In 2019, 65% of the US population had seen a dentist in the previous year. And also in 2019, 85% of children had a dental visit within the previous year. This can also include the outreach programs, the school-based programs for these children. When we look at these, we know that there's a large part of society that struggles with either periodontal disease, dental decay, or both. And it's that access to treatment and finding ways to help encourage better self-care that we're going to look at today. According to the ADA in August, after the entire world has experienced shutdowns, dental offices were shut everywhere from 6 weeks to 3 months, depending on the state and the location you were in. But in August, the ADA reported 98% of dental offices had reopened at that time. However, the average that they were seeing was about 73% capacity of patient load compared to pre-COVID. There's a lot of factors that can play into that, including the patient behaviors and also the recommendation at that time to let rooms sit and have a little more time between patients. And the ADA, the CDC, the World Health Organization all have recommendations. Some align, some differ a little bit, and they are consistently changing. They did recommend, let's reduce the aerosols, which would mean for hygienists, less ultrasonic or no ultrasonic power scaler use, and solely based on hand instrumentation. Also to screen your patients and prioritize, maybe postpone elective treatment to a later date or to a time that the risk would not be as high. We can do that with options like implementing teledentistry within our practice. We used to think teledentistry was more of a public health setting, when in fact it's very useful in daily practice, as well as reaching out to those patients that may be reluctant to come in. They also recommended engineering controls, air filtration equipment in each of the rooms and operatories, and then distance. We know that dental workers are one of the highest risks for contracting COVID in the workplace because we are up in everybody's face where that virus lives and the respiratory tract. So they recommend distance, which we know we can't do. In addition to time between patients, leave those rooms sit for a while. And then, of course, all the additional PPE that we now must wear. So beginning of 2020, masks, loops, some would just go with scrubs, some had a gown. Now we're seeing everything just shy of a hazmat suit when we treat patients. So it's all that extra PPE, not only for the wearer and the burden, but also the cost of it that we look at. From the patient's perspective, there's barriers to care. And we have to be able to realize what those barriers are. One big barrier is fear. Patients are concerned about being exposed to COVID. They're not wanting to leave their house. They may also have a strong fear of the dentist, which may have been brought on by childhood experiences or fear of being told something's wrong. There's also the barrier to embarrassment. When we see patients and they say, yeah, I know I haven't been doing what I was supposed to do, their fear of being shamed for the lack of care. When we're in quarantine or when we're in isolation, everybody was letting things slack a little bit, at least in my experience as well. You went from dressing up for going into the office to sporting your sweats or your yoga pants, and reality-wise, nobody can smell your bad breath through a Zoom meeting, right? So they let the home care slack, whether it's dental care, oral care, personal hygiene. They just don't want to be reprimanded because they know that they haven't done as much. And then always the other big barrier is cost. They're concerned about the cost of care, dental care, treatment needed, the cost of missing work, and also we're finding the cost for finding daycare or somebody to keep your children while you go in for a dental visit is not as easy. And then we look at the patient behaviors. Obviously, we're seeing the new term Zoom fatigue, where, like I said, people are not providing as much self-care because we're meeting over a virtual site. We're not meeting face-to-face. Quarantine and the isolation and everything COVID has brought us has also caused depression for many. And we know when people are in a depressive state, they're also struggling sometimes with personal care. You're working from home. So people are snacking more frequently on what they have around. They're sipping on coffee or soda or other drinks that they normally would not, depending on their work setting previously. Like I said, decreased personal care. And then we're also seeing some reports of stress. Stress related also has been increasing bruxism. So more fractured teeth, maybe more jaw pain from clenching and grinding at night, and how we can reach those patients and encourage things, even home remedies they can do. So it really breaks down to the trends of the times. We're seeing more decay. Patients behaviors are putting them at risk of a higher rate of decay. that snacking, that sipping on soda, sipping on juice, sipping on coffee. They're also delaying routine care. So that preventative care and screening, they're putting it off. And that dental checkup. Because they're delaying it, many times when we finally do see them, or because schedules were pushed out, as hygienists or dentists, we're doing a lot more hand scaling when we're providing that preventative care than we would before. Another thing that is very relevant and that we need to be more aware of as providers is most patients don't realize they have xerostomia until it gets really bad. And they don't seek that care. That causes of it may be medications. The majority of medications list dry mouth as a side effect. CPAP machines have a tendency, even if they do have the moisturizers with them, but they do have a tendency to dry out the oral cavity. Smoking, we know, does. Depression is another. And then systemic effects like diabetes will affect it too. And mask mouth, the new 2020 term, mask mouth. People are becoming much more aware of their oral malodor. And if they're wearing a mask all day long, they're not rehydrating. They may not be drinking the water like they normally would. And we know that dry mouth can lead to that malodor or that mask mouth that patients may talk about as well. It can lead to that halitosis, that bad breath. It can lead to mouth sores. It can lead to excessive thirst. It may also lead to poor sleep. If they're waking up and they have that cotton mouth feel, it can also contribute to cracked lips, is a good sign that we see in the dental office, or change sensation, change taste. We know it's going to increase the caries risk as well as increasing the perio risk. And in fact, there's almost a 50% reduction in salivary flow before the individual notices a change. And most will wait, even if they notice that change, most will wait until it's life-altering or incredibly uncomfortable before they seek any answers or seek help. As dental providers, we say, how can we help? We may be able to catch these patients before they get to that painful state. There's many, many fantastic products on the market now that really will help coat the oral tissues and help increase it. Biotin has always been the one you've always heard about initially. Patients sometimes will find the dry mouth lozenges, which were great. OxyFresh has a gel called Super Relief Gel or Pro Relief Gel. They've got two different formulations that provides the essential oils, the xylitol. It's SLS free, and it's really a pretty clean product. And then Sunstar Gum also has the whole line of dry mouth relief. They've got the gels, they've got oral rinses, they have a toothpaste, and then the oral spray, which is a great option for patients to throw in their pocket or throw in their purse when they're on the go. So they're able to really come together and find different options, and they have humectants and they have moisturizers. So not only do they moisten the oral cavity, but they also soothe it. What works for one patient may not work for the next patient. My recommendation to my patients is I'm going to give you either samples of these products or I'm going to give you a list and I want you to try. It doesn't matter, you find something that works well for you. If they're doing the lozenges, make sure they're for dry mouth and of course, sugar-free. Home care and systemic disorders can have an incredible effect on the oral cavity. Diabetes, we know with diabetes, you're at increased risk of periodontal disease, stroke, and a very high risk of severe COVID reaction. So some of these patients who are diabetic are going to be hanging out a little bit more at home and maybe more reluctant to come into the dental practice. We do know that it's a bidirectional relationship, that diabetes and perio disease often go hand in hand. If the diabetes and the hemoglobin A1C levels are high and poorly controlled, that perio disease process is going to progress faster. If the perio is out of control, the blood sugars are harder to control. Usually, if you can get a handle on one, you can get a handle on the other as well. So it is an increased risk for patients that have poor home care, that are diabetic, or have poor home care and are uncontrolled diabetics and have perio disease on top of it. We know those two go hand in hand. And those are some of the patients we have to be sure we're reaching out to and stress that importance. There's a recent study that came out on the link between perio disease and COVID severity. A Journal of California Dental Association is quoted as saying, patients hospitalized with COVID-19 were more likely to experience respiratory failure if they had gum disease prior to being infected with the virus. We know COVID has a huge inflammatory response to it as well. Interleukin 6, which is the protein that's also associated with perio, causes systemic inflammation within the body. Individuals may aspirate that oral bacteria into the lungs. They go on to say that there was a strong association between the need for mechanical ventilation and high interleukin 6 serum levels. Many of those required ventilation. So ensuring that our patients are able to keep up with good home care can help reduce this risk. It also showed or quoted to say that patients with severe COVID had a 2.9% fold increase in the interleukin 6 levels compared to the patients that had mild or moderate COVID. So it's food for thought. It's food for thought. The pandemic has brought about many things that we haven't realized, and making those associations is incredible because many people in our society think the head is disconnected from the rest of the body. When you ask them about medications they're taking, and they say, oh, nothing affects my teeth. We need to make people aware that it is a connected system. One great way to work with your patients and work with any individual is through motivational interviewing. And it's really used to counsel that individual or find a factor to aid in behavior change. And the definition is it's a directive, client-centered counseling style for eliciting behavior change by helping clients to explore and resolve the ambivalence. So you find out the barriers. For instance, you have a patient with profuse bleeding upon probing and very red, very puffy tissue, and you saw him 6 months ago for the prophy. And you want to know what prompts them to seek care. If they're not doing the recommendations, if the brush, floss, the gold standard at home, do you ask them, are you flossing? A yes or no question. Or do you say, how many times a day do you floss? And are you using anything additional? You leave it as an open-ended question. Part of motivational interviewing is ORS, open-ended questions, affirmation, reflective listening, and summarizing. So you're going to want to ask open-ended questions, like I said. When that patient responds, you provide that affirmation. Really praise what they are doing right. And listen. Listen is a key part because you can acknowledge and identify those barriers or those challenges to it. And we'll go over an example in a moment. And then summarize it and suggest a solution. There's where our alternative means come into play. For instance, you may say, Mr. Jones, what do you use to clean between your teeth? Mr. Jones will tell you, well, I know you're going to tell me to floss, but I can't get it wrapped around my fingers, so I just brush. Great that you brush twice a day. However, that brush doesn't always get between the teeth. And he says, yeah, I know, but I just can't do the floss. I understand your fingers getting wrapped around it are difficult. You acknowledge that you've listened. And then we look at providing solutions. And as dental professionals, I think that's where we shine. I'm going to send you home with a few alternative products to try. Can you try each and see if there's one you would like to use daily? And you can also ask them, can I check in with you in a couple weeks to see which one you like for my records? And make yourself a note to do it if you choose to do so. But it's giving those alternatives. I often joke with my patients, if I have ones that don't like a particular product, I'll give them samples of 2 or 3 different types of things to use interdentally, or 2 or 3 different types of oral rinses to help with dry mouth. And I joke, I said, it's just like Christmas. You come here and you leave with presents. And so we make it fun, we make it lighthearted, and it's definitely not that lecturing. We know that's a fear and a barrier of patients. But we also have to be able to modify the behaviors and finding what those behaviors are. If they're struggling with decay rates, maybe with education. We talk about the timing of the acidic exposure. Those acidic beverages should be with foods at mealtime, not sipping on them throughout the day, not sipping on them when you're at your desk. In between meals, drink water if you can get them to do it. Food choices, looking at creating a diet with a mixture of acidic and non-acidic foods together. And if those acidic beverages are consumed between meals, consider chewing gums that maybe have xylitol in them immediately after to help promote that buffering capacity of the saliva. Temperature of acidic beverages, generally cold's a little bit better than warm. And then they may benefit from reducing that acid exposure by using a straw. And then don't swish. So drink your wine down, don't swish it. I like my red wine just as much as anybody else. Statistically, soft drink consumption has increased 500% in the US in the past 50 years. 500%. On average, each American consumes about 56 gallons per year. And then approximately 80% of 14-year-olds drink at least a 20-ounce soda a day. This is sodas. This doesn't count in energy drinks. How many times have you had a patient come in with their gigantic cup of soda that they set out on the counter while they're in there for their dental appointment? And really, those serving sizes were 6.5 ounces in the 1950s. And in the 60s, they went to 12 ounces. By the late 90s, serving sizes are 20 ounces. I often see people come in that have 36, 48-ounce cups. So they're getting an excessive amount of not only the sugar, but that acid intake. And we have to consider the buffering capacity. And that buffering capacity is the ability of the buffer to resist changes in the pH. So a highly acidic drink with a high buffering capacity is going to resist the attempts of the saliva to neutralize the acid more than something that either was a lower buffering capacity or lower acidity. Like I said, a drink with a low buffering capacity, like sparkling water, will not take as high amounts of the base to raise that pH. So sparkling water, while maybe it's not the ideal for some individuals, it's better than those highly acidic drinks. Also consider the extrinsic factors, the prevention part of it. So reduction in the quantity and the frequency of the erosive foods. I often use the example with my patients to put it into perspective and make it relatable. I say, okay, I like these things too, but if I have a soda and you have a soda and you drink it down with your meal and I take it and sip on it for the next 3 hours, that's going to be much worse for my teeth than drinking it down and being done with it. We want to shorten that contact time within the oral cavity. I often recommend that after any acid exposure, they rinse with water. Even after coffee, it can help get some of that off too, and maybe deem it as we're going to try to reduce some of the staining as well. And then stimulate that saliva production. So that's where maybe that gum or the xylitol mints come in. But we really need to change that messaging with patients from routine to preventative care and how we can do that. So better personal care really equates to an easier dental visit for the patient. They have less hand scaling, less work we're doing on our part. I know my patients have said that when they've changed their home routine and they come back to see me and they say, wow, you didn't work as much, or it didn't take near as long as it did the last time. Well, it's because what you're doing at home makes the difference. And how do we educate those patients? A statistic I read is when you look at them and say, how often do you floss? 41% of the subjects in the study said every day. 39% said occasionally. And 20% said never. So how do we capture that nearly 60% that aren't doing it every day? Maybe they don't like the flossing, they don't like the feeling, they don't like having fingers in their mouth. So let's find the alternatives. Up to 80% of interdental plaque can be removed, whether it's using things like wood picks, toothpicks. Those are going to stimulate the tissue as well. There's some great ones out there that have different options and very high quality. N-Tuff brushes, especially for patients in ortho or implants or for Cations, works fantastic. I have patients who absolutely love the rubber tip stimulators because it stimulates the tissue, especially in that blood flow when we look at implants in ortho, and it's pretty gentle. One of my favorite go-tos is the interdental brushes. I think they work almost for everybody. There's different sizes, there's different shapes, and it's finding that one that works, especially if they've had some perio disease or some recession. These are usually my go-to product over floss for those patients. When we look at other alternatives, for the patients who don't floss or don't like to floss, and especially with children, I love the flossers. It's a one-hand, easy in, easy out. Absolutely will recommend those to a lot of people if they're not going to use string floss. That's my first go-to, or interdental brushes. Oral irrigators, fantastic product again. I also absolutely love soft picks because they're a rubber ended to them. They're soft, they're gentle. Love these around implants as well. Also can be very thin, similar to the toothpicks for patients to use theirs. So find those alternatives they're willing to use. And then we have the patients who struggle and they say, well, you can come in and you can clean, but I don't like it because it hurts. It always hurts here. You can touch here, you can touch here, but you cannot touch here. Often those lower anteriors because of hypersensitivity. Ways to treat that. We need to look at ways to either occlude the dental tubules, and this can be through in-office, this can be at-home products, or depolarize the nerve. We also have seen lasers or sealers like a gluma along those lines work well for desensitizing as well. Those adhesives or sealers, excuse me. In cases that just are unbearable for patients, that may be a small class 5 filling in that abfraction or that area at the gum line. And that is something that dentists will make the decision on, but it may be what's needed to provide relief. You heard me mention OxyFresh before. I like the product, it's clean. It uses essential oils, aloe. They have the Pro Relief is their sensitivity gel. They have fluoride and fluoride-free options. Sensitivity toothpaste, whether it's something that has been on the market, they've tried before, some work better than others for different patients again. I also always question what type of toothbrush these individuals are using, because certain brushes or if they're trying to use a medium brush can cause more sensitivity than if they're using a gentle brush. And ask them, what does your brush look like? Does it go up and fray out? Does it look like it's been ran over by the car a few times? Because if that's the case, they're brushing way too hard. Those patients, sometimes you can identify from the way the dentition looks and the recession, and sometimes it's a conversation, and I always ask. Because with those patients, recommend they hold the toothbrush in their fingertips, because they cannot get the pressure by holding it in their fingertips to brush as they can in the palm of their hand. And they're more aware of how they're doing it. Power brushes are another good alternative. The OxyFresh gel is an at-home gel. Patients can use it as they see fit. Colgate, anytime, anywhere. Another fantastic product. It has the arginine and the calcium carbonate in there. It is a serum that you can put on in office and send your patient home with that little tube of it as well. Another factor to consider is bruxism. Remember the study we talked about? If they have more stress in their life, which 2020 has brought all of us that, we're seeing more bruxism, we're seeing more fractured teeth. That can also be a cause of sensitivity. Are they creating those microfractures? Maybe it's time to do an occlusal guard for this patient. But that's another factor to consider. Xylitol may not be for everybody, but xylitol, it really modulates the immune system, has that antimicrobial activity. It has been shown recently to contribute to reduced respiratory tract infection, sinus problems. They make xylitol nasal sprays that work really, really well. There has been a couple studies come out that think the xylitol nasal sprays or xylitol can help diminish the amount of COVID exposure, or not exposure, excuse me, but the amount of the virus. So I know that is in studies as well. But xylitol, not only for health benefits, but definitely for the dental benefits. If you're recommending these to your patients, be sure to tell them not to use too much, because too much xylitol can have GI disturbances for patients. So Make sure they're not chewing the whole pack of gum all within a short period of time. What can dental professionals do when we look at peri-implant mucositis, peri-implantitis? Dental implants are becoming more the norm rather than the exception for people that lose teeth. Many general practitioners are now placing them rather than only oral surgeons. So the accessibility, the availability, and insurance coverages, costs, everything that plays into that means we're seeing more patients that have dental implants. But they do require special care. They're still at a risk. People think that when you put them in, you can't have any problems with it, which couldn't be more untrue, because that bone integration within those threads. I highly recommend, like I said, the picks or the proxy brushes for all of my implant patients. I've worked in perio and I've worked in general practice. So you want to ensure the brushes you're recommending are soft enough they're not going to damage those implants. Also, expandable floss. And show your patient how to do this, or recommend to them that you have to go up kind of underneath that crown to get to the underside of it, or wrap it around a little bit to be able to adapt that implant body. End tuft brushes are fantastic for implants to clean around those, as well as oral irrigators. I am a huge fan of the oral irrigators and being able to really flush everything out for ortho patients, for implant patients, for perio patients, just about anybody. And especially those who won't floss or don't like to floss, that may be the best alternative. Orthodontic patients. My daughter just completed ortho, and it was about the worst 2 years of my life, reminding her to brush and care and do everything that she would be. They pose a specific challenge because our ortho patients are usually kids, right? Maybe kids who don't have the best home care to begin with. It is more difficult to clean without the use of power scalers when we have ortho patients in the chair. With the recommendations of limiting aerosols, we're doing lots more hand scaling. And these patients often have to really be motivated to continue home care or take the extra steps they need for home care. I know very few of them, to be honest, that are willing to get in with traditional floss underneath that wire every single day. This is where the picks, the brushes, specialty ortho toothbrushes are all fantastic for these patients, especially that oral irrigator. And connecting with these patients also has changed in 2020. Where teledentistry, like I said, has been more of a public health leading up to it, or a way for providers to connect with other providers. 2020 and dental offices closing has really brought on a rapid adoption of teledentistry with patients. And it offers us the opportunity to monitor, to educate, to screen, and to address any of these patient concerns through teledentistry. While dentistry is very much a hands-on profession, there are things that we can do virtually. And it is pretty amazing what a patient can get photo-wise with a smartphone. They don't have to have an intraoral camera at home. It can be done through their smartphone. It can be done through any of those. And with COVID surging in so many areas right now, we're in that second wave, that patients are reluctant to stay home. There are states that are starting to roll back their restrictions and their shutdowns. So how can we capture these patients, monitor, provide the care, answer questions, and be able to still generate some revenue? And many are finding that with teledentistry. It can be synchronous, which is live, like video calls, or it can be asynchronous, which is a store and forward. There are CDT codes that apply for both. They're always used in conjunction with your evaluation codes or your case management codes. More and more insurances are paying for these. It's still the way to capture these patients that even come from a distance that can't get to you, or they may be in a care facility or home, or maybe they're in quarantine themselves, but have swelling and a toothache. What can you do for them? So the ADA has relaxed some of the regulations temporarily on HIPAA regarding teledentistry. However, you can still be held liable. So make sure it's a good software program, a good program you're using that can capture that information, that can become part of that patient record and patient chart. If the insurance company wants more documentation or whatever it may be, or that patient comes back and said, you never told me, it can be part of that patient record. It's a fantastic way to do it. And really, don't underestimate the importance of an intraoral camera in your practice, because a picture really is worth 1,000 words. These are 2 photos that I took personally. The one on the right, I can try to explain to this patient all day long the bone loss, the perio disease, the large amounts of calculus deposit, and the need for periodontal treatment. And what do? They nod like they understand, and you can see it in their face that they're like, yeah, but it doesn't hurt. You show them a picture on the left on the big screen TV, and it sells itself. Absolutely. They can see what you see. It can be used as a motivator in our patient education. I will use an intraoral camera on almost every one of my patients during a day. If I see anything I want the doctor to see, if I see anything of record that I want to keep and assess later, but very largely as part of my patient education and my case acceptance. Every operatory, if not every hygiene operatory, should have an intraoral camera use and to be available. Don't underestimate the impact of that picture will have. Burkhart Dental, one of the big suppliers, said the images captured by intraoral cameras have been shown to increase case acceptance by as much as 35% without saying a word. And I think this statement says a lot. I've experienced it. I've experienced it within practice. I've seen the revenue generated from it. You can buy an intraoral camera and have it implemented and integrated within your software you have in your imaging software with your practice management software, and use these, and it's going to pay for itself within the matter of one crown, one patient accepting perio treatment. Education, everything really has to come together for this patient to be able to do everything, and our options are endless. Motivational interviewing, I think many of us probably do this in practice anyway without really realizing it. But identify those barriers. Acknowledge what your patient's trying to do and does well. And then find what works. Soft picks may work for one patient, they may not work for the next, they may not like them. But find what works for your patients and give them options. That's the key to it. Give them options rather than just traditional floss. And assess the risk factors. Are they diabetic? Are they at higher risk? Do we need to be a little more aggressive in what you're doing at home? And you may want to explain that to him. Say, you know, when you have diabetes, you're at a higher risk factor for stroke, heart disease, but also gum disease, which can make your diabetes harder to control. I'm seeing evidence of this. Let's get on top of it, plan your professional treatment, and really identify out what you need the patient to do at home. I want you to get an oral irrigator, and I want you to get these interproximal brushes, and you're going to use it. You know, I want you to use this and this. I want you to give it a try, and we can get on top of it together. It's really what you do at home that makes the biggest difference in what we do here. And when it clicks with the patient, you can see it. And then even connect with them through teledentistry. If you don't have those patients who are willing to come to the office or able to come to the office, maybe they have a concern because of sensitivity, this is a great way to connect with them. And it can help generate a little bit extra revenue within the practice right now as well. And really creating that winning team is everybody together. It's not just you as a dental provider holding on to what you can do for your patient. You have to collaborate together, identify the barriers that is stopping them from, is it just a lack of motivation, period? Or is it because they don't like or struggle using certain products? And work together to create that customized plan. Give them options. Really motivate them and make it a positive solution. I know you don't like these, Mr. Jones, but let's try these couple things and see if you work them better. Maybe the flossers that have the really long handle with the changeable heads might be the better alternative because he can hold it better than wrapping string floss around his fingers. Maybe that parent with the child struggles with the floss, or the orthodontic patient just says, it's too hard, I cannot get in there, or it hurts. Well, let's try the oral irrigator. Find those solutions and in a very nice way, hold them accountable for them. Unprecedented times really call for creative solutions with patients. There's some fantastic things on the market that give options for almost every patient type that you have, whether it's that customized plan for interproximal cleaning. It might be the elderly patient that can't grip a toothbrush, so you move to the handles that can go on them to help them, or a power brush. But those creative solutions are really is what's going to make you an ally to this patient or to your patients, because you're willing to listen and you're willing to help them find those solutions rather than expect them to adopt to your routines and the gold standard of brush, floss, brush, floss. So help find those, work together with the patients, and I think you'll find success. I want to thank you. My email is at the top. My website as well. And I want to give a huge thank you to Sunstar for sponsoring this webinar for us tonight. I will go to the questions at the top. If you have any questions, please add them into the Q&A. First question I see, it says, I am so concerned about the patients that I have still not seen openings since May. This may be the way to reach out to those patients. Maybe they're reluctant to come back because of the risk exposure. At this point, maybe reaching out even through a phone call or through teledentistry to provide those options and at least connect with them, know that they're still in there. I don't know what area you're in, or if I believe all states are open now. I would still just reach out to me, even if by phone, for nothing else, just to check in. because they're going to remember that when it is time to come back if they're not. Maybe offer the ability to connect via teledentistry to answer any questions or review. Jennifer writes, what about home fluoride? Absolutely, for those patients who need it, especially when we look at patients who are incredibly high risk or maybe under cancer treatment, that may be the option. I do like the perio study, the perio gel I showed you as well. That had an independent study out of, I believe, out of Europe, that they found in conjunction with scale and root planing, it also provided a better healing in those probe depths post. And it does have a fluoride content to it, or a higher fluoride content prescription strength for those patients that are excessively prone to decay, or decay to, yes, decay, prone to decay, excuse me. Do I have a link to the California study correlating perio and COVID? You have my email, please email me, and I'm happy to share that link as well. It just came out actually yesterday or today. Last question one of my last questions I have is, how would you recommend discussing prevention options with patients that have been told over and over again what they should change? I have found it personally much easier when I make it relatable. It's that motivational interview, find out what their barrier is, or maybe if it's just they don't like, I've had patients who won't use toothpaste because they don't like mint. Well, there's other options we can look at that they didn't know. Sit them up face to face, so it's a face-to-face conversation, not them laying in your chair where they're going to be more defensive. And have that conversation to them. Say, I found this, or I read this, or I watched a webinar that had questions relating to this product. Is that something you're willing to try? Because I think it could really help. And then give them very clear and concise instructions on how to use it. Well, it's second nature for us how to use things. It's not for everybody else. There's a lot of patients think we've removed part of their tooth structure when we scale the calculus. How do you explain that to them? I love taking a before and after intraoral picture. They see the difference, especially when, like the example I had up there, you can see the definitive line of calculus, you can see the staining, and then they can see the results of what you do as a professional. Before and after is amazing. How do you explain to patients when they brush their teeth and they see blood and they stop brushing because they are afraid? I relate it to, it's similar to having a sliver in your hand. When you get a sliver in your hand, how it gets sore and infected, and they go, yeah. Well, it's kind of the same stuff with your gum tissue. It's causing that irritation. We need to get it out so they can heal up. And I will almost guarantee, if you're following, my recommendations at home to brush and use this stuff at home, you're going to see that bleeding stop over the next couple weeks. And it's almost a challenge that they're willing to take, but we make it relatable to something they've known they've had versus more of an abstract idea of their gums. Do you recommend a water pick to be used with a mouthwash instead of just water to better flush out and reduce bacteria in perio areas? I think this is a very personal question, depending on the individual. I like adding a little bit to it. Granted, it's diluted down with the water. It's very, for some people don't like just the feeling or the taste of water alone. I give them options. I said, you can do this, but I let it be up to the patient. Has perio disease spiked in patients who were in for prophy? I'm not sure, Charlie, if I fully understand that question. we have to screen our patients every time we see them. You should be probing, you should be checking in that way as well. Let's see. Are electric toothbrushes hard on implants? I don't think they're hard on implants. I like the vibrations of the power brushes because they help flush that water and that toothpaste through a little bit. I'm really a fan of brushes for most people. Let's see. Is there a no taste fluoride? I don't know that there's necessarily a no taste fluoride. I think there's some home fluorides or professional fluorides that definitely taste better than others that could be good options. Young makes some that do have flavors to them that are pretty good without being too overwhelming. As far as home stuff, again, I really am a fan of some of the cleaner products, such as the OxyFresh products, because they are such a clean. They do have a very mild mint taste to them rather than a very strong taste. And then let's see, I think we've worked our way through most questions. So I want to thank you very much for joining me. Again, you can always email me at jamiecollins.rdh@gmail.com. And again, thank you very much to Sunstar for sponsoring us to be here. And I will turn it over. So thank you.